My name is Jeffrey Jackson, and I'm an orthopedic surgeon at St. Mark's Hospital. Many patients come in with two problems in their shoulder, a torn rotator cuff and arthritis. And they lose the ability to raise their arm, and their arm is very painful. So one option that we have now is a reverse shoulder replacement. This operation gives the ability back to the patient to elevate their arm and do so in a pain-free manner. It does so by us changing the anatomy of the shoulder. We switch the socket side to the ball side and the ball side of the shoulder to the socket side. This is something that the French came up with about 2 or 3 decades ago, and initially we didn't believe that it would work. It took a little while for it to catch on in the United States, but it's really exploded recently. It's become much more popular, and there are many patients with these two problems in their shoulder, both arthritis and a torn rotator cuff. And a reverse shoulder replacement has given them the ability to have good function in their shoulder and move it in a pain-free fashion. The recovery after reverse shoulder replacement is surprisingly quick. Oftentimes patients that need that procedure have friends or they themselves have gone through a rotator cuff repair and they're expecting a similar type recovery. But most patients find that it's much easier. Usually they're only in a sling for about 4 weeks after the surgery. They start moving their arm much more quickly than they would have if they'd had a rotator cuff repair. So the recovery is much quicker, much faster, and much easier.